Oropharynx cancer is a type of cancer that typically affects the tonsil and the base of tongue. And so when people say oropharynx cancer, it actually can be two different types. It can be HPV negative and then HPV positive. And what I mean by that is there's one large subtype that's related to the human papillomavirus. So this subtype is actually on the rise and now the dominant type that we see in patients today. So the patient group that we're seeing being affected by HPV positive oropharynx cancer is a little bit different. So it's not the typical smoking and alcohol related cancer that we see with HPV negative. It actually tends to be in younger patients, not necessarily with a history of smoking, healthier, and presents in a very different way. So as opposed to painful sores in the mouth or something that you would notice at the primary cancer site, we often first see these patients because of subtle swelling in the neck. That's actually a node, a lymph node, that's become enlarged from the cancer itself. These tumors, again, they typically don't grow very large before they tend to metastasize and go to the neck, and is where we often see it first. Prevention in HPV positive cancer is a little bit different than HPV negative. And while it always is a good thing for your overall health to eliminate smoking, limit alcohol use, this type of cancer is actually best prevented by vaccination. So similar to what you see in cervical cancer, HPV positive cancer is caused by the HPV human papilloma virus. And there are a couple high-risk types that are included in the vaccine. So this is now a vaccine that's given to both boys and girls. And actually the FDA has recently increased the age at which you can get it. So it's always worth talking to your primary care physician and see if that's something that makes sense for you based on your history and your exposure. And then the other element of HPV positive cancers, it's also related to number of sexual partners. HPV positive oropharynx cancer in my practice is typically caught fairly early stage. It's usually when patients have appreciated a subtle swelling or a lymph node in the neck, and often are sent for a biopsy and then referred into us. HPV positive oropharynx cancer is very treatable and curable. There are two main subgroups that we look at. So there's surgical management and then non-surgical management. So surgical management, typically we use some sort of minimally invasive type operation to remove the tumor. And so I do transoral robotic surgery. So we use the Da Vinci robot to remove these tumor types. And we can do this in a very minimally invasive way without making external incisions for that part of the operation. The other option is using lasers to do the same thing. The other option is chemotherapy and radiation, or some combination of all three. I think what patients gain from coming to the University of Colorado for cancer treatment, specifically the HPV oropharynx treatment, is number one, we offer minimally invasive surgical approaches that are not available in most places. And that can be really beneficial because it can allow patients to reduce the number of treatment modalities they need, sometimes even to surgery alone, and then can very much reduce the morbidity of treatment itself. And then what I think is probably the most important aspect of what we offer is just a very comprehensive multidisciplinary discussion, both in a tumor board setting and then also clinically among the medical oncologists and the radiation oncologists and the surgeons here, and it's very unique.